Okay, we're live. Hello, everyone. Thank you all for joining tonight's Trendy Tuesday with me and Dr. Sophia Yen, CEO and co-founder of Pandia Health, as we discuss trending birth control topics. Before we begin, don't forget to sign up for Pandia Health's free birth control delivery service. We can also write prescriptions for those who live in Arizona, California, Colorado, Florida, Georgia, Miami, Nevada, Wisconsin, and Wyoming. As a reminder, Pandia Health is the only women-led, doctor-led control delivery service. So without further ado, let's get started with tonight's topic. How are you doing, Dr. Yen?
I'm good. How's your day?
Pretty great, honestly. I'm one of the essential workers, so pretty neat.
Wow.
Yeah, so tonight's topic, guys, is about birth control side effects. How fun is that?
Not fun. Uh-oh, Ariana, I can't hear you.
Oh, can you hear me now?
Yes.
Okay, and I was saying, I know a lot of people have a lot of questions regarding birth control and the side effects. So, Dr. Yen, you're here to answer a lot of the questions that many women, especially my age, but older women as well, may have. So can you give us like a little background on like some of the symptoms or signs and symptoms that you have noticed women having?
Yeah, so the one we always warn about is nausea. So your first time taking birth control, you can have some nausea, but the best thing to avoid that, Google, YouTube, Dr. Yen's tips, first time on birth control. But the worst possible thing you could do is taking your birth control pill first thing in the morning on an empty stomach. So to flip that, the best time to take it is right before you go to bed. In my 15, 20 years of writing birth control, I've only had 2 patients in that entire time wake up from sleep with nausea. Everybody else, that was the solution. The other thing you can try is take it with your largest meal. So if your largest meal is dinner, take it with dinner. If your largest meal is breakfast, take it with breakfast. Not at the beginning of the meal, but after you've eaten all the food, then throw on some birth control pill. So that would be like the biggest side effect. But again, it shouldn't stay after like a month or 2. It should go away. It should get better. If it hasn't, then we can definitely, play around. There are 40 different pills. There's usually 2 or 3 different levels of estrogen, which is the main culprit for the nausea kind of symptom. And I was just thinking, flipping the side effects of birth control, because side effects can be good or side effects can be bad. So mainly, I focus on the good side effects, mainly #periods optional. So once you go on the birth control pill patch ring, you can decide how often you have a bleed. You can bleed every month, you can bleed every 3 months, you can bleed every 6 months, or you can bleed never. I haven't bled for the past 11 years, as long as I remember to take my medicine. If I forget, then I end up bleeding. So that I really like that benefit. The other benefit or side effect that I had with the pill, if you don't skip, it still makes your periods lighter, because every month without any medications, you build up that lining of the uterus to grow baby. And I call that like level 10 thick. But if you're on the pill to patch the ring, you're not trying to catch a baby. So you don't need to build 10 thick. You build like 1 or 2 thick. And then when that bleeds, it's only like 3 days. If normally you're 5 days, it'll go down. And so it's a lot less blood. So, and then lastly, acne. So without hormones, I used to get 1 zit every single month. And I don't remember if it was before or after.
Me too.
and maybe, we should log when or what to figure out the hormone. But I would always get like the North Star here, or here. And then after I went on the birth control pill, gone. So the birth control pill patch ring lowers your level of man hormone, testosterone, to the point that the zit doesn't happen. Or maybe it's just that imbalance, the up and down, and your body's like, woo, zit, Whereas
absolutely,
smooth, no zits.
Absolutely amazing. Thank you, Dr. Yen. I'm sure a lot of women have had those symptoms and they were probably wondering what was going on. So we thank you for just reaching out and saying something, because it can be hard for women to talk about, especially signs and symptoms of birth control, because it's something that a lot of women choose to do for a contraceptive method. So thank you for that. And another symptom that I have heard about was dizziness. How can you explain like the dizziness that occurs maybe in some women or symptoms of fatigue and just overstress?
Yeah. So I think, part of it you have to separate from just life, right? Particularly with the former administration, I felt we were in a reign of terror. And now that we have a new administration, I feel a weight has been lifted off my shoulder. But also, we just had the
Yeah,
year
yeah.
anniversary of COVID, right? And COVID has just been a burden. Like, can I travel? Can I not travel? I'm having nightmares about forgetting my mask, So all of this stress and anxiety, is that from life or is that from the pill? Is it from becoming sexually active or hiding that sexual activity from somebody, your parent? Like I have 25, 26-year-olds living in their parents' house and afraid to tell them they're using birth control. And it's like 50% of high school seniors have had sex and you're 26. So it's not
Absolutely.
unreasonable that you have sex, And so again, is it coming from the birth control or is it coming from just life or being sexual or having a relationship? My joke is sometimes it's better not to have a relationship because you can focus and you can work. And like I ask teenagers, who are you going to talk to if you want to kill yourself? And they're like, my significant other. Who's most likely going to make you want to kill yourself? Your significant other when they break up with
Correct.
you, right?
Absolutely.
Or is he or
Absolutely.
she cheating on me, or just so much drama, right?
Right.
But to your question of like nausea, yes, vomiting would be not normal. If you're vomiting on the birth control pill, you might be pregnant. Check a pregnancy test because the pill pumping, all that can fail. And if you don't take it at the same time every day, or I actually just spoke to an OB-GYN. She got pregnant while taking the birth control continuously. And not because it was continuous, but it works better if you take it continuously because the more days you're off, the greater the risk of pregnancy. But she got pregnant. So if she can get pregnant, anybody can get pregnant.
Oh, man, exactly.
So if you're vomiting, check a pregnancy test. If you're vomiting,
so basically,
go see a doctor.
So basically, if you're having signs of pregnancy, you should take the test. In general, it may not be the birth control.
Exactly.
Understandable, definitely. And piggybacking off the pregnancy thing, how do you know if your discharge is coming from, let's say, pregnancy or some other disease or disorder, or is it coming from the birth control? Does it make your vagina stink? Or, these are questions that a lot of women have, especially with the discharge. So does it cause a discharge or an odor?
Yeah. So I remember in high school physiology studying, the menstrual cycle and the hormones. And the bottom line is you can have discharge every single day, which is not cool, but it's normal. But if your discharge is different and it's stinky or it's itchy or it's green or, it's blood and it shouldn't be blood, these are things you need to look at. The birth control pill should not make your discharge stinky. It should not make it yellow, green. And there is breakthrough bleeding, like spotting, if you don't take it at the same time every day, plus or minus, 3 to 5 hours, and you're taking it one day 8 a.m., one day 8 p.m., all this, or you miss a couple days in a row, then yes, you will have breakthrough bleeding. But if you're taking it at the same time every day, it shouldn't mess with your discharge or make it stinky. If it's stinky, go see a doctor. You might have bacterial vaginosis, or you might have chlamydia, gonorrhea. If there's pain or itch or fever, go to the emergency room or urgent care, because that could be a bacterial infection, and bacteria grow fast. Nothing to do with your birth control. The birth control some people have noted that it made their vagina dry. And some people have said that, and I don't know if that's dry, meaning like when you're sexually aroused and the vagina doesn't get wet, because the vagina is almost always wet. It's pretty moist in there. But I think it may be also a matter of libido. And so absolutely, it's possible that the birth control pill affects your libido, and each person is different. There's 40 different pills. It depends on how much estrogen, depends on which progesterone. Is it a more macho, I was doing in Spanish, more manly progesterone, which has testosterone side effects, which gives you more libido? Or is it a less testosterone effect, but gives you less acne? So you have to balance. Do you want libido, or do you want libido with acne, or less libido with no acne? And in general,
Right.
I'd say like a 20 to 30, 35-year-old has enough libido. And some people, libido is partially mental, right? Like if I think I could get pregnant, I don't want to have sex. This is an anti-libido, right? But if I'm on good birth control, yes, I can have sex and I only have a 3% chance of getting pregnant. I'm cool with that. And so the birth control, even though it technically decreases your testosterone a little bit potentially, depending on which one, but the increase in libido from knowing that I won't get pregnant. It's a balance.
It kind of, yeah, it's a really good balance as well. And I know a lot of women too, they have trouble differentiating between discharge with birth control and then discharge with an STI or an STD. So that's actually very important for them to differentiate and to know the signs and symptoms of each one. As far as the discharge goes, though, speaking more about that, with birth control, I know there's a difference between women, and I know there's a difference in everyone. Can you kind of explain who's at risk for? Is there even a woman that may be at risk for having signs and symptoms of birth control? Like, let's say someone who already has a disorder such as PDD or anything like that. Are they more at risk for getting symptoms than normal women?
I think, one way to judge it, but again, it's 50-50, is did your mom have any bad, evil side effects when she was pregnant? So if she's like a vomity, throw-uppy girl when she's pregnant, you might have some nausea. If her breasts, got really tender and big during pregnancy, but that actually happens with everyone, then, you might have that side effect. The thing with birth control is, and just with actually any drug, 30% of the effects are placebo. So if I tell you you're going to get a zit, 30% of people are going to get a zit if I give them a sugar pill. And so I say think positive. Assume that you are the 95% that do great. But if you're the 5% that doesn't, then you do want to go possibly to the only women-founded, women-led, doctor-led company in birth control delivery, because
Absolutely.
we are evidence-based. And as the only academic doctor founded and led company, I'm all about looking at the data, looking at the science. And as a person of color, looking at, does ethnicity affect our reaction to the different progesterones? And so at Pandia Health, we ask at the end of your questionnaire, please get through the whole questionnaire, we ask you to self-report your ethnicity. And we want to correlate that with, everybody on this pill of this ethnicity does great. And so then the next person that comes in, we're like, hey, why don't you try this one? Or if you're half Korean, half Taiwanese, maybe this one's better for you. If you're, this or that, maybe this one's better for you, rather than one size fits all. The future is customized medicine. The future, if everybody gets their genes checked, then I went to MIT and we can look at the genes and we can see which ones correlate and get all scientific and excited about that. But for now, we're doing just, ethnicity, self-reported ethnicity as a proxy of what might do well for you. So if you're having any problems, absolutely, bring it up with your doctor, physician, whoever you're working with. If you're working with us at Pandia Health, expert care by expert doctors. But know that, you should give every pill ideally 6 weeks to see its full effect, and that most side effects will go away by 2 or 3 months.
Awesome. So side effects, are you saying just side effects don't really last that long?
Most of them get better at 2 to 3 months. If it's still there at 2 to 3 months, then it's time to change.
Okay. And another question too, how do doctors customize birth control for women?
Yeah. So again, customizing it based on your personal history. If you're a newbie, then we go with the one that 95% of people do great on. And we look at the science in terms of its progestational effect and its androgenic effect. The progestational effect is how much breakthrough bleeding. Like if you're not trying to skip periods, and we don't care about how strong the progestational effect is. And then did you bring up that you have poor libido? All right, then I'm going to juice your libido a little bit. But, oh, you're really concerned about acne, then I'm going to turn down the testosterone a little bit. But if you say nothing, we're going to give you the one with the least amount of side effects. It's pretty good for skin. And then again, 95% of people do great. The 5% that don't, then we can tweak it. And at Pandia Health, we automatically, with anybody with a new med or new to skipping pills, we'll follow up with you in 8 weeks and see how you're doing. But if anything comes up before then, you can contact us. We have amazing patient care advisors. We have secure chat. You can text us, though know that texting and email is not HIPAA compliant. So secure chat is the best thing if you have something regarding your medical condition that you want to keep confidential.
Okay, and another big thing too with birth control, I know a lot of women are kind of afraid of to talk about are Pap smears. So are Pap smears also a part of the process to getting birth control?
So I teach physicians to prescribe birth control, and a lot of physicians use the Pap smear as this carrot or maybe a stick. Like you can't get your birth control unless you get a Pap smear. And so that is really old school. The Pap smear is not indicated until you're 21 years of age. And as I mentioned, average high schooler, senior, 17, 18-year-old, 50% of them have had sex. And so before they have sex, I hope they would get birth control so they don't need Pap smears for another 3 to 4 years. You do not need a Pap smear till 21 in the United States unless you're immunosuppressed. So if you have HIV, yeah. If you're taking oral steroids every day, not anabolic steroids, but like to suppress your immune system because you have autoimmune disease, yes. If you're taking inhaled steroids for asthma, no. Just if you're taking a pill every day of steroids, yes. Because if you get HPV, which is the thing that messes up the Pap smear and indicates cancer, and you're immunosuppressed, the odds of you killing it and getting rid of cancer is lower. Whereas the rest of us, they actually don't want to catch it right when you get HPV because, again, 80 to 90% will get rid of it. And so if we're like, oh, my God, and we get all active and cut up your cervix and stuff, then there's going to be consequences. We'd rather give you some time to kill it and then be like, hey, is it still there? So that's why first Pap smear at 21, but do not let anyone withhold birth control from you because you didn't get a Pap smear. So at Pandia Health, one of the main reasons I created this company, one is so no one runs out of birth control on our watch, but two,
yes.
Access, right? So don't hold birth control hostage because these two things are separate. Pap smear is preventing cancer, and that is absolutely important. But again, 21 years of age, and then I think it's every 3 years for a Pap smear. But if you're under 21, you got until 21 until you need a Pap smear, and no one should Pap smear you. Pelvic exam is where they like spread them and then they may put their hands in to check, is anything hurt? Is everything good? All that. Again, that's not necessary for birth control. If you're having lower abdominal pain and nasty discharge, yes. But if you're like, I feel nothing, I just want to prevent unplanned pregnancy, or I have bad evil periods and I just want to turn them off, these can be done with no Pap smear, no pelvic. But we want to make sure that you know that Pandia Health is not your primary care doctor. Please see a doctor every year for checkups, labs, listen to your heart, your lungs, whatever. And if you're under 26, once a year at least, check for chlamydia. And you also have the option of HIV. We don't do that here at Pandia Health. Maybe in the future we will. But again, we are not your primary care doctor. We're just here to make sure no one runs out of birth control on our watch and that people have birth control wherever you have internet and a mailbox.
And I think a lot of women too are appreciative of Pandia Health because we're able to send them via mail. And so we don't have to wait on, a doctor's prescription to go to the pharmacy and then, going back and forth. So it's great that Pandia Health actually has the resources to allow so many women, especially girls who are very nervous about speaking about sex and birth control with their parents or their peers, they're able to talk to you and then a lot of the other consultants as well to get something that's better for them, that's best for them. So I can advocate too. Pandia Health is great. I'm going to be starting to use it myself in a couple of months. Yeah, in a couple of months, I will be using it myself as well. And I know a lot of women too who are 22, young, just fresh out of college, just living life. They would love to have the opportunity to just have something for them. You know what I mean? Just to have something where they are in control. The women are in control, and they don't have to worry about, of course, like you said, it's nice to go to your doctor and get your physical, of course, But if you don't want to, or if there's nothing wrong, it's nice to just be able to smoothly get what you need and to continue on as well. And aside from birth control, so Pandia Health also, we also offer emergency contraceptive as well, right?
Yeah, so we like everyone to think of emergency contraception kind of like a fire extinguisher. Should be sitting in that corner. You want the one with the farthest expiration date. Most of it can, 2 years from now will expire. And our Pandia PSA that we always have to put out there is anybody with a uterus, please punch in a calculator, computer, Google BMI, and put in your height, your weight, and check. And if your BMI is 26 or greater, know that Plan B and its generics, the over-the-counter emergency contraception, won't work if your BMI is 26 or greater. And my BMI is 25, and thanks to COVID and a whole bunch of dessert and Easter, it might be 26. So Plan B and its generics do not work if your BMI is 26 or greater. So at Pandia Health, we suggest everybody get Ella because it works up to a BMI of 35. Once your BMI is 35, your only hope is IUD. And then another tip, because we are evidence and cutting edge and science and academic, is it used to be just copper IUD, but now a New England Journal Medicine article says that you can use the hormonal IUD, which we like so much better. The copper IUD, the two major side effects, more blood, more cramps. And certainly if you're a person who doesn't bleed much and don't feel your periods, copper IUD. But if you're a person who bleeds like stink and feels every cramp, not copper IUD, but know that you can use the IUD for emergency contraception. And so you stick it in, and then you have a great birth control method that'll last for 5 to 7 years. And the IUD with hormone is actually better than sterilization in a woman, where you snip, and, it's very invasive. The IUD and the implant beats that. The hormonal IUD.
Awesome, amazing. I know some women are very appreciative of that too, because I know me personally, I like to have my cycle every month. I like to know that I'm not pregnant, but I know a lot of women too, they don't really mind not having a cycle and not having to, worry about it. So that's also awesome, especially since we do offer the emergency contraceptive. Are there any side effects that they should look out for that too with the birth control?
So you're saying emergency contraception with birth control side effect? Or
Yes.
you're saying, okay. So the key to know is if you're using Plan B and its generics, then you can just take it and then continue taking your birth control. If, you had a contraceptive accident where you forgot 3 days in a row in the middle of, the first 3 weeks of your pack or something like that. But if you're going for me, I call it going for broke, just continuously taking active pills. If you've taken 3 weeks of active pills at least in a row before. So I'm like on week 5 or 6 or 7 or whatever. So there's 3 weeks of active pills before. And then I forget 3 days of pills. I don't have to take emergency contraception, because if you got the 3 weeks ahead of it, then it's just a withdrawal bleed, like your last week off of it. So you don't need emergency contraception. With the Plan B and its generics, if you take emergency contraception because you messed up somewhere here, the condom broke or whatever, you can just restart your birth control immediately. However, you asked a really good question. If you're using Ella is an anti-progesterone. And if you start taking your birth control pill and all of the hormonal ones have progesterone in it, then you're defeating the effect of Ella, which is trying to block progesterone. So if you truly had a contraceptive accident and you want to prevent unplanned pregnancy and you took Ella, you should wait 5 days after the Ella to start your birth control again.
Okay, awesome. I'm glad you cleared that up, because I didn't know that. I thought you could either not discontinue the birth control and then take the Plan B and then start the next month, or just keep going with the Plan B. So I didn't know how that worked. I know a lot of women too, they're kind of confused about that. So I'm glad you actually mentioned that and mentioned the time period of it all. That's absolutely amazing. And last question. So for tonight in particular, as far as birth control and side effects go, what would you want our audience to know about the different types of birth control and the side effects in general?
I think it's important to know that research has shown that birth control doesn't make you gain weight. Certainly, if you take a birth control pill and you notice that you gain weight, okay, you are the person that it affects differently. And know that there are 8 different progesterones and that there are 40 different pills. So if you get a side effect you don't like, please note which progesterone, what dose estrogen. tell the doctor, and we'll make sure to not do that dose and not that progesterone, and maybe try a different one. But if you're like, I don't remember, then that doesn't help anybody. So if there's any badness, please write it down. But the take-home message is that there's 8 different progesterones. If you don't like one, there's 7 others. That there's 40 different pills. So if you don't like one, there's 39 others. And what other side effects? The main one that we discussed on the last call was infertility. So my joke is, yeah, birth control makes you infertile when you're on it, because that's why you're taking it. But I think the real question is, I think the real question is when you come off, will I be infertile? And the research has shown it does not. So the pill, the patch, the ring are out of your body within 3 days. That's why if you forget to take it for 3 days, you bleed because it's out of your body.
Makes sense.
Yeah. And so then the shot, though, it sticks in your fat or muscle. It's a fatty thing that sticks around. That might take like 8 months or 9 months to wash out if you've had a bunch of them. If you had one, I would assume it wouldn't take as long. But if you've been on it for like 5 years, then it might take like, 8 months for that to wash out. The IUD, as soon as you take it out, it's out of your body. And the implant, as soon as you take it out, it's out of your body. So that once it's out of your body, you are not infertile. It has no long-term fertility things. What people also confuse is that 10% of women have or will get polycystic ovarian syndrome. And women with PCOS, polycystic ovarian syndrome, they don't pop out an egg every month. And if you can't pop out an egg, you can't get pregnant. And so if we take 100 women and put them on the pill, and we have 100 women and they're not on the pill, and then we check in with them 20 years later, both groups, 10% will have a hard time getting pregnant. But if you're on the pill and you come off and you can't get pregnant, you're like, that pill, it was the pill. No, it was just you got PCOS or you had PCOS and you didn't know about it and the pill kind of hid it from you. And now you're having problems. And the other kicker that I forgot to do, because it's harder in Spanish for me, is that infertility docs actually put people on the birth control pill to normalize their hormones. And then they come off and bam, you get pregnant.
Really?
So for the PCOS lady, your hormones are whack. We put you on birth control and they get normal. As soon as you come off, you heard, it's going to be hard for you to get pregnant. It might take a while, but you're most fertile right when you come off because your hormones are most normal when you're on the birth control pill. So if you want to get pregnant in your PCOS, as soon as you come off the birth control pill and you bleed and then you build, that's the time to go.
Gotcha. Amazing. Thank you for clearing that up as well. Thank you so much, Dr. Yen, for just giving us your time.
Yeah, well, thank you for doing this. I love that, you as a future medical student are helping women and those with uteri, get educated.
Absolutely. That's my number one goal. And I'm going into OBGYN as well and women's health. So this is right up my alley.
Yay.
Thank you so much. Thank you to those as well who tuned in. Don't forget to follow us on social media at Pandia Health and check out our website if you have any other questions on the topics we discussed tonight. As always, feel free to leave us a comment below. Feel free to reach out to us at Pandia Health. We're always happy.
Always happy to answer any questions about the birth control pill, patch, ring, and my joke, everything V.
Right. Well, thank you, Dr. Yen. Bye.
Bye.